Hey guys, my name is Nick Sivrich. I'm a physical therapist and I want to go over this week's question of the week. This week's question of the week is about the elbow, and it's about a common term called tennis elbow. And a lot of people think that you have to play tennis in order to get tennis elbow, and that's really not the case. That's the layman's term, but the true medical term is called lateral epicondylitis. And basically, there is a bone here at the end of your long bone, your humerus, that's called the lateral epicondyle. And the muscles that do this to your wrist connect there. That's their origin. That's kind of where they sit. Well, a lot of times there will be inflammation at that lateral epicondyle where those muscles connect, and that causes pain. So a lot of people that normally get it will be anyone that kind of sits with their wrists extended for a repetitive amount of time throughout the day, or a longer time, like people that type a lot, people that write a lot, people that drive and kind of extend their wrist like this. Any type of wrist extension. Now, it can also happen by an injury or someone hitting their elbow on something, but normally it's from some sort of repetitive motion. And basically what happens is every time when that's inflamed on that bone, what happens is every time you extend your wrist, it pulls on that area that is inflamed, and it causes pain all the time. And sometimes people will even get symptoms down into the muscle belly, and it also goes down into the hand. So a lot of times people will get injections. They'll get what's called a cortisone injection, and that's just a steroid that a surgeon, a primary care physician, someone will inject that right into the site to try and decrease the inflammation inside. But I do see people with this frequently, and other things that I recommend for them to do is they have a little brace that kind of goes around the forearm, and basically what it does, there's a little cushion on it that kind of pushes on the muscle itself, and basically just kind of takes the origin from where it is to where it's kind of pushing with that little pillow, just to try and take a little pressure off. And that sometimes helps. Usually people will use that throughout the day. Sometimes people need to get surgery for it, where they just kind of remove the muscle from the bone, shave down any type of bone spurs, and kind of clean that up and then reattach it. But that's kind of a last resort. I do recommend, when people have symptoms of this, do not let them go long, because once this turns chronic, it's very difficult to treat. At least in my opinion, and what I've seen throughout my career, it's always, and this really goes with any diagnosis, early intervention is the best. So I hope that helped today, guys. I hope you got some value out of that. Please like it, share it. Follow me on my social media, and check out my blog at nicksivrichpt.com. Thanks. Have a good day, guys.